So we're looking at the foot of a patient with rheumatoid arthritis, and they come in for regular treatment of this painful plantar lesion. So usually what we do is trim this one out, and it ends up being really quite a painful corn. So as usual, we go ahead in here. We're using number 15 blade. The whole area has been pre-surgically washed down, and so we go and remove that overlying callus cap, and already you can see that little white ring and the central section starting to break down. So it's where all the fluid gets pushed out of the skin into the deeper tissues because of the pressure of the corn. Now, this patient being a rheumatoid arthritic, it deforms the toes, and when the toes retract, you can see they're all bunching up on top of each other. What happens is it causes pressure on the metatarsal heads. So this one's actually underneath the third metatarsal head. And you can see it's going deeper and deeper in here to try and get that out. And you can see where the tissue's actually broken down. So it's really important to get these ones and try and deflect the pressure, and also remove any of the hardened skin so it doesn't cause an ulceration, which is this one is already starting to break down. So the problem you have with rheumatoid arthritis is it can cause the deformity of the toes, which causes pressure over the bony prominences. So we go ahead and just remove it and try and smooth it all out as best we can, and make it just less likely to take pressure over there. Now, this patient is also a diabetic, so they're a risk of infection as well. So diabetics have a much greater chance of infection and amputation. So that's how we remove a corn and callus from the foot of a patient with rheumatoid arthritis and diabetes.